The most important vital parameters that must be monitored for all anesthetized patients are the pulse rate, the blood pressure, oxygen saturation, and the body temperature. Capnography is not the most basic monitoring tool, but I believe that everyone who ventilates patients with machines should have a capnograph to be able to fine-tune the ventilation parameters. Making small mistakes, such as hyperventilation resulting from inappropriate ventilator settings, can have negative consequences after longer time. While trying to provide the best anesthesia service and enjoying the benefits of automatic high-end ventilators, using appropriate monitoring equipment is a must, and capnography is a minimum necessity in this scenario. After the initial ventilator settings are complete and everything seems to be fine with the patient, just watch what happens in the next 5 to 10 minutes with the end-tidal CO2 value here. After making any changes in the ventilator settings, you need to wait for a few minutes until the CO2 stabilizes before you adjust the ventilator again. Right now you can see a yellow warning message on the top indicating that the end-tidal CO2 value is too high. The actual value is 58, but the reference range for end-tidal CO2 of dogs is between 35 to 45 mm of mercury. Hence, this patient is hypoventilating. Be careful and think before you act. Discovering that any of the monitored parameters are outside of the normal range doesn't mean that it should be treated automatically. The decision whether or not to treat any condition and how to treat it can be a sophisticated process. Depending on the clinical scenario, you may decide to hyperventilate certain patients, such as those with intracranial tumor and an elevated intracranial pressure. However, if your patient is hypotensive, you may have to downgrade or turn off your ventilator and permit a certain degree of hypercapnia. However, using mechanical ventilation to keep your healthy patients normoventilating is appropriate if the circulation is stable. So, the end-tidal CO2 of this patient is 59, which is high. So, this patient is hypoventilating. Let's try to fix it together. What are the options? You can change the respiratory rate or increase the respiratory rate, or you can increase the tidal volume, or a combination of both. Normally, I start with setting the respiratory rate to about 10, and then I increase the tidal volume step by step. Therefore, I increase the minute volume and hopefully decrease the end-tidal CO2. When I'm increasing the tidal volume, I have to be mindful about the peak inspiratory pressure. The relationship depends on the compliance of the chest of each patient, so it's individual. There is no golden setting that works for every patient. So let's try to slowly increase the tidal volume. We started from 10 milliliter per kilogram, which is 50, and the upper range is 15 milliliter per kilogram, which is 75. So we will slowly step up from 50 towards 75 and watch out for the peak inspiratory pressure not to exceed 10 centimeter of water. Okay, we set the tidal volume to 60 and we got 40. So there is a discrepancy. The discrepancy is partially explained by inaccuracy in measuring such a small tidal volume. So in such cases, don't put too much emphasis on these small differences, but watch out for the peak inspiratory pressure. As you see, now it increased from 8 to 9. So by increasing our desired tidal volume, the animal responded with a higher peak inspiratory pressure, which moved into the same direction. So I think that's okay for now. Let's increase it further because the end-tidal CO2 is rather high. I have chosen 70, and let's see if the pressure is going up even higher. By experience, I anticipate that this setting will not be enough for this dog. So let's increase the minimum respiratory rate also to about 15. And because the peak inspiratory pressure did not increase any further, now it increased to 10, but despite it increased to 10, I will increase it just a little bit more to about 75. So now we are at the upper range, upper end of the normal range, which is 15 milliliter per kilo. Let's give it a few minutes to see if the CO2 wants to change. It's slowly decreasing, and we still don't have the tidal volume that we really desired. So I believe this could be increased a little bit more. The peak inspiratory pressure is 10, but increasing it to 11 or 12 would not make any difference. It would not endanger this patient. So I believe he needs a higher tidal volume. I put it to 85. Okay, it's slowly coming down. Now the peak inspiratory pressure and the resulting tidal volume are more reasonable. So I believe this tidal volume is more or less appropriate for this patient. And the CO2 value is decreasing. But in order to make it decrease faster, temporarily, I will increase the respiratory rate to 20. And I believe we will have to decrease it after the CO2 value came down from these levels. You see the decrease is now faster, but we need to give it a few minutes until the value stabilizes. The tidal volume remains appropriate for the patient, and the peak inspiratory pressure is tolerable. So these values are good. The respiratory rate that we got is in fact 20, and there is no spontaneous breathing. The CO2 is coming down. We just need to give it some time. So I would just continue it as long as it's needed, and when the CO2 is acceptable, then I would slowly decrease the respiratory rate towards 15 or maybe 10 as the clinical situation requires. After a few minutes of ventilation with unchanged ventilator settings, you can see that the end-tidal CO2 nicely normalized, and now it is between 35 to 45 millimeter of mercury. Hence, this patient is normoventilating. The tidal volume setting is more or less appropriate for this patient because it's about 15 milliliter per kilogram, only a tiny bit higher, but I don't consider it significantly higher. The respiratory rate, which is normally 10 to 15, is currently set to 20. So I will reduce it to about 15 to be closer to the normal range. And let's see what happens with this animal. Hopefully, we will still remain between the 35 to 45 range. Or even if we are a little bit outside of that range, it can be acceptable. If you could only achieve that the CO2 comes to a normal range with excessive ventilator settings, then I would be more willing to accept that the CO2 is going outside of the normal range a little bit. There are different guidelines of how much CO2 you can tolerate, and it's not written in stone. Some people think animals end-tidal CO2 need to be kept under 60 for animals, and they would ventilate the patient when it's higher than that. Some others think that 50 is the magic number to follow. I would rather think that if you have a high-end ventilator such as the Veta 5, I would do a reasonable effort to keep this value between the reference range. Be careful that the normal end-tidal CO2 values in cats are lower than in dogs. So in cats, the normal range is about 5 millimeter of mercury lower than for dogs. I commonly accept 30 to 35 as a normal range for cats. Regarding the peak inspiratory pressure, the rough guideline is that the PIP should not exceed 10 centimeters of water in smaller patients, let's say under 10 kg of body weight. And for larger patients, the PIP should be less than 20 centimeters of water. There can be exceptions because some dogs may have low chest compliance, and using a higher PIP for these animals may be necessary. This is actually the case for our patients right now, because we are allowing him to have a little bit higher PIP than 10, which was predicted by his body weight. He seems to be needing a higher tidal volume. However, we should do effort to mitigate the increase in tidal volume, and in such cases when we are having difficulties with chest compliance and the tidal volume is already as high as we want it to give, then we should increase the respiratory rate, maybe outside higher than the normal range, towards 15 to 20 breaths per minute. Also, if you have difficulties with setting the tidal volume, especially in an obese patient, keep in mind that the tidal volume needs to be calculated for the lean body weight. The ventilator settings can be very complex and it needs experience. It is an art indeed. Keep in mind to make only small steps towards the direction of your goal. Check the results often and refine your technique as needed. This way you can achieve continuous and safe control of the clinical situation. Ventilating clinical patients with the Veta 5 is not that hard. And after watching these videos, I hope you increased your knowledge and you will be able to use this technology with confidence. My name is Dr. Tamás Ambrisko and I'm a veterinary anesthesiologist. Thank you for watching.